Hello everyone. Let's talk about some common myths amongst patients undergoing spine surgery. The first and the most fearsome is usually the risk of neurological injury leading to paralysis. Neurological injuries and resultant neurological weaknesses is exceedingly rare in these days of spine surgery. This is largely secondary to advancements in the skills, technology, and superior outcomes after the most minimally invasive forms of spine surgery. The second important myth amongst patients is that they will be bedridden for a long time. Usually, patients are in bed only for the first 24 to 48 hours after an elective spine surgery. We encourage the patients to get up and move around as comfortably as they can. The first few weeks of spine surgery do not require any kind of physiotherapy except for your normal walking and day-to-day activities. Another important myth amongst patients is that patients will often require a second surgery after the first one. This is also debunked in the sense most patients undergoing a spinal procedure will not require a second procedure. There are certain group of patients who are predisposed for repeat surgeries, and those numbers are exceedingly low. Patients undergoing spinal fusion procedures are often scared because of the risk of mispositioned implants. With advanced technologies, the risk of misplaced screws and implants is quite low, and spine surgery is deemed to be very safe. The last and most important myth about spine surgery is the fear of poor post-operative outcomes. Poor outcomes after surgery are largely a result of poor indications and not the surgery itself. Most patients undergoing elective and emergency spinal surgeries tend to have good post-op outcomes.